Hi, I'm Dr. Mark Rosenberg, and I'm here to talk to you today about hyperbaric oxygen and hyperbaric oxygen therapy. Hyperbaric oxygen therapy is not nearly as popular here in the United States as it is in other countries. Certainly in Russia, there are a lot of studies that have been done on the benefits of hyperbaric oxygen therapy. As we age, the oxygen concentration to many of our tissues decrease. We certainly realize that we're dehydrating constantly. When we're born, we're about 75% water. When we're in our 70s and 80s, we're probably about 50% water. I'm sure many of you out there have pinched your skin and realized that it doesn't bounce back as well as it used to. And why doesn't it? Well, we're losing our collagen, our skin is thinning, and that is a result of not only changes in our hormones, but decreased blood perfusion. Decreased blood perfusion because we have decreased volume of water, okay, because we are constantly dehydrating. And if we have decreased perfusion of blood, we have decreased oxygenation. Associated with decreased oxygenation is we have plaques forming in many of our arteries. So we know the end result as we age is decreased oxygen to the tissues. And there are studies where they've actually taken probes in various tissues in people that are aging, and they show that continuously, as they age, the oxygen concentration goes down. So what if you try to put that oxygen back? Are there any benefits? Well, there are two ways to do that. There are the standard hard shell chambers that you'll often find in hospitals. And these chambers have oxygen that is pumped into there, and you can get very high atmospheric pressure. And that's got to be done under controlled conditions with a technician who's certified in hyperbaric oxygen therapy, as well as a doctor who's trained in it, because you can get what's called oxygen toxicity. Well, this is for specific conditions, and this is not what I think the masses out there listening to me should look into. But there is another option, and that's called portable hyperbaric oxygen chambers. Now, the portable chambers are actually filled with room air. They're pumped with room air enough to get the maximum pressure or atmosphere absolute to 1.3. So if you're at sea level, the atmosphere is just 1. In these chambers, you get it to 1.3. And that's about the equivalent of being under 10 feet of seawater. Now, when you go in these chambers, you have an oxygen concentrator that will deliver 100% oxygen that you'll breathe through a mask, but it's being compressed at 1.3 ATA. So one of the benefits of getting these chambers that you can have in your home, and it's a chamber that I'm actually getting for my own home. Well, the benefits are getting oxygen to tissues that are previously was not getting adequate oxygen. And certainly many of the professional athletes are using it. Now, we think it may be beneficial for the brain. Now, many people out there may be familiar with autistic children. There are no great treatments for autistic children, but there are many people that offer portable hyperbaric chambers for their children to get into 5 days a week for many weeks. And previously it had been thought that it wasn't effective. Well, there was a large study that was recently published that showed that children with autism, when they got regular hyperbaric oxygen treatment, had a significant improvement in sociability as well as cognitive ability. So now there's finally data showing that it's helpful for autism. There is a lot of literature out there to also suggest that it may be helpful for many neurodegenerative diseases like Alzheimer's and Parkinson's. There's also literature suggestive that it may be helpful in stabilizing some tumors. Now, this is premature. There's a lot more work that needs to be done, but what we see is that many tumors are hypoxic. That means very low in oxygen. And as I teach in my cancer fellowship, a well-oxygenated tumor is a happy tumor. And what does that mean? It means a tumor that does not have to spread to other places because it's receiving adequate oxygen. Now, what about cosmetics? Interestingly, when you're in the hyperbaric chamber for a long enough period of time, and what I mean by that is an hour a day, but you do it for enough weeks in a row, you'll start noticing your skin looks better. And why does your skin look better? Because increased oxygen will increase blood flow to the skin and increase collagen deposition. So there are many, many benefits for using hyperbaric oxygen therapy. And I actually will be showing, I will be on the news with a patient of mine who had some mild cognitive impairment. And literally just after 1 week of using hyperbaric oxygen, he had significant improvement. And certainly he uses it all the time. So hyperbaric oxygen therapy is a very unique modality that I think many of you should explore doing. With the portable chambers, you can do no harm. And what I mean by that is because by FDA regulation, these chambers cannot exceed an atmospheric pressure of 1.3 ATA. And so there is no danger of oxygen toxicity. You can only help. The worst case scenario is it doesn't help. But you should consider exploring the benefits of hyperbaric oxygen for neurodegenerative diseases, for many diseases, and even just anti-aging. This has been Dr. Mark Rosenberg talking about hyperbaric oxygen and the benefits of hyperbaric oxygen therapy. Thank you.